How long do you need to wear a brace if you have scoliosis? If you're watching this video and you have scoliosis and you're looking at bracing as an option, or you have a child or an adolescent that has scoliosis and you're considering bracing, one of the most common questions we hear is, how long will I need to wear my brace, or how long will my child or teenager need to wear the brace? Hi, Dr. Gubbels from ScoliCare Denver, and in this video I'm going to answer those exact questions. Now, the most important thing, it really depends on the person's age and what type of scoliosis we're treating. So let's talk about adolescent idiopathic scoliosis, which is the scoliosis that actually begins in teenage years. This is the most common type of idiopathic scoliosis. So girls typically start puberty around 11 years old, and on average they end puberty around 16. So on average the puberty is around 4 to 5 years. So if we catch it early on, and depending on the type of curve and someone's a candidate for bracing, a girl will on average wear a brace for about 4 years. And the same thing as a boy. Boys typically start puberty or their growth spurt around 13 years, and they typically finish around 17, 18 years old. So again, around 4 to 5 years. Boys tend to grow a little bit longer, where girls are more on that 4-year time frame for puberty and growth, and boys are more on that 5-year time frame. So it depends on when we catch the curve. If someone has a more aggressive curve, let's say over 20 degrees, and we catch it at the very beginning of puberty, they're probably going to be wearing a brace for around 3 to 4 years. And the same thing for a boy. If we catch it in a male adolescent at the very beginning of puberty, around 13 years of age, they're probably going to wear that brace roughly around 4 years. Now, there's a few things we look for to determine when we are going to wean off bracing. One of the biggest is when we have seen no growth in height for at least 6 months. The other thing we're going to look for is their actual bone age. And you can look at something called a Risser sign. That's a common term people become aware of, where we're actually looking at the closing of the growth plates in the pelvis. But more accurately, we look at the growth plates in the hand. It's a bit more detailed, a bit more accurate. And when the last growth plate in the radius, where we call it a Risser sign 8, is where we typically start to decrease, or someone starts to end bracing. Some places actually recommend weaning off bracing earlier. However, we have still seen people's curves progress, and at the very end of growth, even though the growth is slowed down, so we typically don't start to wean until they're actually at Risser sign 8. Now, if we catch a scoliosis earlier, like in a juvenile, which is someone between the ages of 3 and 10, we call that an early onset scoliosis, they will potentially be wearing a brace for longer because they're going to be growing a lot longer. Ideally, if we catch scoliosis when someone's younger, let's say 7 or 8 years old, we can greatly reduce that curve. And in juveniles, they're a lot more flexible, so sometimes we can get them to the point where the curves are very small and we can actually stop bracing. And we may potentially start bracing again during growth spurts. We'll monitor that. If we reduce the curves in juveniles, it's important to know that these curves have a high risk of reappearing, so we're not like in the clear yet. But we've also had cases where we've reduced the curves and we've monitored the curves even throughout puberty, and the scoliosis has stayed really small and we did not have to brace again. But to recap, in the juveniles, when we get an early onset scoliosis, the likelihood is we'll be doing bracing over more years. Our goal is to reduce that curve to the point where we can actually take a break in bracing, and we may have to reintroduce bracing with the onset of puberty and growth spurts. But sometimes we can go through the growth spurts without having to do bracing again if the curve stays small. Now, if you're a young adult and you have a curve that's painful and that's what's bringing you into the office, let's say you're a 30 or 40-year-old male and the real goal is to reduce pain and keep it from progressing, a lot of times we're going to do bracing for at least the first year. If there's a chance of reducing the curve, we're going to wear the brace more aggressively like we would when you were an adolescent. But typically, if there is a potential to reduce the curve, we're going to know what that is within the first 6 months. So we're going to wear the brace for at least a year. Now, after that first year, some adults will get to the point where they are comfortable not wearing the brace and they're really compliant with scoliosis-specific exercise. So we can actually stop wearing a brace in many adults. If you're an older adult and you have a more aggressive degenerative scoliosis, a lot of times older adults continue to wear their brace for 4 to 6 up to 8 hours a day ongoing, because it provides such pain relief and it's really halting the progression of the curve. And there's a few things we can look for to determine the risk of curve progression. In young adults, we may stop wearing a brace after a year. If there's a high risk of progression or there's still pain, then we may keep wearing a brace as more like stabilization kind of like braces on teeth. So I hope you found that helpful and that answers your questions about how long we may need to wear a brace. And for more information on other non-surgical treatments like scoliosis specific exercise, be sure to watch our next video.